start a just started a recording. Just like to welcome everybody to tonight's session for Giant Schnauzer University. Let me get these slides going here as well. So you should see a presentation. Somebody nod your head if you can see it. And we're going to go ahead and get started. And before I turn it over to tonight's presenter, I'm just going to give everybody a little background on what Giant Schnauzer University is all about. Um, just some reminders though, while we're in the meeting, keep your connections muted unless you're asking a question. When you want to ask a question, you can raise your hand in Zoom and you can unmute and state your name and ask the question. It might be best to kind of hold those towards the end. I don't think the presentation itself is going to be that long, so it may be easier just to kind of save your questions and comments to the end. And you can also type questions or comments in the chat window and we'll recognize them there. So just a little bit of background on Giant Schnauzer University. This is a program we put in place a few years ago, and it was just intended to improve the quantity and the quality of the educational offerings that are presented by the Giant Schnauzer Club of America. And the objective for GSU is just to provide helpful, accurate information on a host of different subjects. And we really want the club to be seen as the resource for anybody that wants to learn about the breed, whether you're a club member, not a club member, whether you've got standard schnauzers or Dobermans or whatever. We don't care. If you're interested in learning more about the breed, we welcome you into this program. And it is built on a university theme. Um, in terms of how it's organized, we have individual departments to kind of keep things a little structured. And if you ever have questions, want more information, have suggestions, or you want to somehow get involved, you can send an email to that address there, giantsschnauzeruniversity@gmail.com. So, like I just said, it's structured into different departments. We've got an activities department. That's where Bridget, who is our speaker tonight, she's the dean of that department. But tonight's topic's in a different one. We have a breeder's education, something called giant studies, grooming, which they've done several presentations over the last couple of years, health and heredity, which is where we are tonight, and something we will eventually have is what we're calling puppy junior college, which is really targeted at future owners or new owners and kind of teaching them the ropes about dealing with their giants. So again, tonight's presentation, it's Health and Hereditary 301, Decision Making for Euthanasia. You can read the little syllabus there. It's talking about a tool, quality of life scale, or the 5 H's and 2 M's scale. And it's something that's intended to give you some structure and clarity and a little bit of a more systematic approach on making these kind of decisions, because it's always a very, very difficult and hard thing to do. And having some kind of structure, a framework there is definitely useful. And just a little bit of background about our professor, Bridget Turler. Her and her husband have had giants since 1995. They've dealt with 4 of these situations in the past and just very recently dealt with another one. And they found this tool we're going to talk about to be very helpful. So we're going to get into some of the details of that. And hopefully you'll find it useful and informative and ultimately helpful whenever you have to deal with this. I do have to mention this disclaimer. The club is very happy and pleased to be able to offer all the courses we do through Giant Schnauzer University. We try to be as accurate and helpful with the information we provide as possible. Ultimately, though, the club, its officers, the faculty members, we're not accountable for the decisions that you ultimately make. And particularly on subjects like what we're going to talk about tonight, it becomes something that you absolutely are working with your vet on and veterinary professionals, but we're just trying to give you information that can make you better informed. So I'm going to stop sharing now and turn things over to Bridget. So Bridget, you should be able to share and start your presentation.
Okay, great. Thank you for the introductory, Chris. Just give me a second here. Okay. Whoops. I don't. Okay, maybe more than a second.
It says it's starting. It's
There we go.
We're getting there.
Okay. I think you should be able to. Oh, I have this list of people here on the side.
Yeah.
Can
No, we can't see the list, but we can see your slides.
Okay, you can see the slides
Yes, ma'am.
with interruption. Good. Okay, then I'm going to start. Thank you very much. So my name's Bridget Turler, and I'm going to be presenting the decision making for euthanasia using this 5H2M scale. And it's a new tool that I came across when dealing with seeking out additional guidance or support for the end of life decision that we just made with our last dog, Arn. He's pictured here at 12 years old with the insert of him in his prime. So I'm going to just walk you through the scale, which is also referred to as a quality of life scale, which was adapted from the original 5H2M concept presented by Dr. Alice Villalobos in 2004. Throughout the presentation, I'm going to include giant schnauzer specific considerations and also reference Arn's personal struggles that we were looking at each category of the scales. Okay, there we go. So the scale evaluates 7 categories. That's the 5H2Ms, and they stand for hurt, hunger, hydration, hygiene, happiness, mobility, and more good days than bad. So each category scored a 0 to a 10. And having just hospice care or moving in that direction can be incredibly stressful. And it's also well documented that when we're under a lot of stress, that we're not as focused and we can lose perspective on things. So I felt this is a great tool to help keep us grounded during this time and focus on trends and observable symptoms rather than our emotions during this time. In addition to help focus on Arn's behaviors and their changes, it helped structure family discussions during this very emotional time that we just went through. So the first category is hurt. And for this category, we're assessing pain. Giant schnauzers often do not vocalize pain. So it's important to look for subtle signs. And subtle signs would include changes in movement. Now, this could be they pace more than they normally do. Do they seem unsettled? Are they holding tension in their face? Sometimes they scrunch between their eyes, or their ears will be pulled back, or their ears get pinched. You also look for panting. That's actually pretty common when the dogs are in pain for panting. And this is panting that's not associated with exertion or heat exposure. Additional considerations for this category is the pain preventing the dog from resting comfortably? Is it interfering with quality sleep? Is current medications effective, or should they be adjusted? In Arn's case, he was panting due to pain, this is a picture of him panting in pain during his last couple weeks. He also exhibited pinched ears and was not sleeping well. Hunger. For this category, we're assessing whether the dog's daily need for food is being met. Giant schnauzers typically enjoy food and maintain a predictable eating schedules, so changes in appetite are usually pretty noticeable. Signs of declining hunger include reluctant to eat, needing to be hand-fed, so they're getting pickier about what they will eat, not finishing meals. Additionally, vomiting and noticeable weight loss goes into this category also. So with Arn, he struggled with food due to stomach issues that he had because of the pain medications that we had on. This resulted in him vomiting and loss of hunger. Bernie did an excellent job adjusting his diet and exploring all possible options each time Arn had challenges with eating. Occasionally, we also used anti-nausea medications to help bring his hunger back online. Hydration. For this category, we're assessing whether the dog is meeting their daily need for water. Giant schnauzers, being large dogs, can deteriorate quickly when dehydrated. Signs that a dog may be not getting enough water: reduced interest in drinking, and so dehydration includes specifically tacky gums, decreased skin elasticity, You can do that little pinch test and how quickly does the skin go back flat after you pinch it. That's how you do that one. And then just lethargy. If subcutaneous fluids are needed, consider the stress level in the dog, as sometimes the treatments can be more uncomfortable than the benefits. In Arn's case, he was drinking less over time, but it was due to mobility issues. So we just brought water to him several times during the day, offer him to drink, drinking it. Additionally, we left it next to one of his beds so that water was much closer than the normal water station that we had when he was younger. Towards the end, even with the support, I believe he was limiting his water to intake as he would only drink when he was very thirsty about once a day. Hygiene. For this category, we're assessing whether the dog's cleanliness and comfort needs are being met. Giant schnauzers can have a thick coat and then furnishings, and these can trap moisture, increasing the risk for matting and skin problems. And this is especially as mobility declines and they're laying around more. Other signs that hygiene needs are not being met include urine scald and overgrown nails. Health issues can also make it difficult for them to stand for grooming. With Arn, I groomed him on the ground to make the process more comfortable. But over time, however, he became less tolerant even of this modification. Happiness. For this category, we're assessing joy and interest in their surroundings. A giant schnauzer's happiness is closely tied to their sense of presence and engagement within the household. Signs to watch for include responsiveness to their surroundings in a positive way, or conversely, signs of depression, anxiety, loneliness, boredom, or fear. Indicators that happiness may be declining include acting withdrawn, no longer greeting family members, losing interest in family time, toys, or routine activities. In our experience, our giants have always enjoyed spending time with us, even when facing serious health challenges. Even towards the end, Arn still wagged his tail when we came home, even though he couldn't get up anymore to greet us. He also continued to enjoy head scratches throughout the day and cuddle time in the evening with Bernie. I found this category particularly challenging to score, as Arn experienced small moments of happiness throughout every day. Mobility. For this category, we're assessing the dog's ability to move comfortably and safely. Signs that mobility is becoming a problem is hesitation to get up or lie down, slipping while walking, avoiding stairs, fear of walking or slipping on slippery surfaces. Because of giant schnauzers' height and mass, falls can have a greater impact than smaller dogs, though factors such as bone density, muscle mass, and how they land play a larger role in injury risk. Large dogs are also harder to assist, which is especially true for our large male giants. The challenge of assisting our dogs also increases as we age and if we have any joint problems, such as back problems. With Arn, I had to straddle him, squat down, place one hand on each hip, and use my legs, not my back, to lift both of us up safely. To help with mobility in the house, we place yoga mats in areas where Arn liked to lay down and along his walking paths. They provided much improved traction on our hardwood floors and were inexpensive at Goodwill. This is a picture of our house at the end there. You can see we pretty much covered every square foot there. On a side note, it's amazing how many people give up yoga mats if they own a purple mat. There's only 2 there that are blue. More good days than bad. For this category, we're assessing trends that indicate whether comfort or suffering is becoming dominant. Is life still net positive for the animal? It captures trajectory, not just status. It reflects the caregiver's lived experience of the dog. It helps identify when quality of life is slipping despite treatment. With Arn, his decline was so gradual that it wasn't about ups and downs from one day to the next. It was more about how much quality he had in each day. As when his mobility declined, we all adapted to the new routines. We felt Arn was content enough to carry on, but not fully at ease. Putting it together. Each category is scored from a 0 to 10, which of course adds up to 70 points. A total of 35 or higher may suggest the quality of life is acceptable, while a score below 35 may indicate poor quality of life with significant compromise across multiple domains. This scoring system is not meant to make a decision for you. Rather, it's designed to support you in thinking through that decision. On November 21st, we both agreed to assist Arn's passing. By the end, he appeared to be in constant pain, could only walk about 5 feet before needing a break, and he had stopped eating full rations. Even then, being with us brought him comfort. Tools that can help tracking your giant schnauzer status include daily or weekly journals, a calendar, a spreadsheet to record scores over time. So what if a single score is extremely low? Well, that's definitely a critical alert, but in many cases, changes can be made to improve that rating, such as adding yoga mats for traction, adjusting their diet or pain meds, moving water closer to the dog. However, irreversible extremely low scores indicate substantial impairment to the dog's overall well-being. Over time, these issues can affect other categories as well. Giant schnauzers tend to mask pain, so a very low score signals a severe change and should be taken seriously. Veterinary partnership. A strong partnership with your veterinarian is a tool to support our giant schnauzer's health. Sharing quality of life scores with your vet provides a clearer picture of your dog's daily struggles and can help guide their recommendations. Your veterinarian may be able to offer palliative care to improve quality of life, assist in managing symptoms during hospice care. They can also help you understand the stages of decline to expect. Emotional considerations. Making end-of-life decision is emotionally overwhelming, and feeling guilt is completely normal. Using the quality of life scale can help refocus your thoughts towards compassion rather than judgment. Remember, giant schnauzers are expert at hiding pain, which often means that owners only realize the extent of their dog's suffering in hindsight. Ultimately, this is a deeply personal decision. There is no single right answer. Planning ahead. Figure out and putting a euthanasia plan in place can provide tremendous support during this time, as preparing in advance reduces panic and ensures things go smoothly when the time's right, and helps ensure your dog's final moments align with your values. Discuss with your veterinarian what the euthanasia process will look like and what options are available. Some families choose home euthanasia for a private and peaceful goodbye. If you prefer this option, you will likely need to find a veterinarian who specializes in home visits. You can usually locate one by searching home euthanasia along with your location. In our experience, we usually have the vet come to the car, as our giant schnauzers have a strong positive association with being in the car, making it a comfortable spot for the procedure. However, even with this simple adjustment, it can present challenges. On one occasion, our regular vet was unavailable, and the covering vet refused to come to our car. We had to take our giant home and find another vet that would perform the procedure there. With Arn, we made sure not only our regular vet, but the vet that would be covering on our days off would be able to come to the car. Planning these details in advance provided reassurance and minimized our stress when the time came. Another great resource is this article that we came across while researching additional support for end of the life decision. This article is How Will I Know? Assessing Quality of Life and Making Difficult Decisions for Your Pet from Ohio State University Veterinary Medical Center. Additionally, on page 6, they have an assessment that is based on the 5H2M scale, but additionally, they are basing it on 2 additional resources. And so they, instead of having the 7 categories, they have a total of 25 statements that you rate on a scale of 1 to 5, indicate your level of agreement with each of the statements. It's a different way to help you walk through the process. I found the quality of life scale that we use was a simpler approach, but it's an excellent article and nothing wrong with more tools to have because everyone might find support in different tools. Final thoughts. This 5H2M scale can provide clarity, structure, and emotional grounding during one of the hardest decisions we make for our dogs. Additionally, by understanding giant schnauzer specific behavior, especially their strong emotional bonds and tendency to hide pain, you can recognize signs of decline more clearly. Above all, remember that euthanasia is a final act of love, relieving suffering and granting a peaceful passing. In some situations, financial considerations may affect how long you can provide end-of-life care. If money is a factor, the Giant Schnauzer Club of America offers welfare grants of up to $2,000 to help cover medical care and other support for a family giant. Thank you for attending. Thank you to the Giant Schnauzer Club of America providing a platform for this presentation, and to Chris Reed and Adam Duke for their guidance and feedback. May you never have to use this tool, and may all your giants pass peacefully in their sleep.
Okay. Thank you, Bridget. I think everybody probably feels same thing I'm feeling right now, but thank you for sharing that very personal and emotional story. It's a difficult subject, but it's something that we all eventually have to deal with. And I think kind of like you said at the end, I mean, our dogs give us unconditional love for their entire life, and the one thing we can do for them is help them have a dignified end of life. And this tool sounds like a very good approach to making that somewhat of a objective decision. I know I've struggled with it in the past. One of our first dogs we had, I couldn't let him go, and we ended up keeping him for too long, and it was for our benefit or my benefit, and not for his. And it's just a lesson you really have to learn. You have to ask yourself, why am I prolonging this decision? And having tools like this help you help some of us make those kind of decisions better or at the right time. So anyway, again, Bridget, thank you for sharing that very personal and touching story. It meant a lot. So I'd like to open it up to comments or questions from anybody that's in the meeting. If you have questions about the tool that Bridget discussed, if you want to share something that you learned by going through this process yourself, anything you really want to talk about, we've got a few minutes. So does anybody want to say something? And you can just unmute your connection, and we don't have too many people in the meeting, so just unmute your connection and say what's on your mind.
Bridget, do you know if this concept is taught in veterinary schools?
It just came out in 2004, so I do not know the extent
Okay.
of it, but if you Google it, there's
Hmm.
quite a few places out there. So it is being presented. It was presented in a veterinarian magazine at first, but now like Dove Lewis, which is close to us, has their own. It's the exact same 7 categories, but the write-up will be a little different under each one. Um,
Uh-huh.
they're all based on the original concept presented in 2004.
So I know I worked at a vet clinic and I left it last summer, and I had never heard of this. So if the vet isn't using this method, is that just bring them information on it? How would you kind of go about that?
So all it does is structure your observations.
Okay.
So they would be things you'd be talking about, the vet would be asking, is your dog in pain? Are they eating well? Are they drinking well? So they're kind of normal things the vet's already thinking about, but it's structured so that the person has been looking at them so they can bring them in an organized way to the vet for a discussion.
Yeah, that makes sense. I didn't know if you would work like one-on-one with your vet with this, or you could, I guess. But
You
it is a good.
So I didn't, when we talked to our vet, we didn't come in with our little spreadsheet that I kept. But we came in with, how can, like, his eating, could we have some medicine to help with the hunger? And
Yeah. No, I
yeah,
think it's a great tool. I was just trying to put it together. Is the vet going to work with you on it, or it's more for the person? So it's a great tool.
yeah, I think it's probably more for the person because the vets
Yeah.
are thinking about these things.
Yeah.
And I think another important aspect too, it's not just a snapshot, right? It's the scores
Yeah.
over some period of time, right? So it's, you're
Well,
looking for the trends and,
and that's why I was kind of thinking working with the vet, so you're all kind of following it.
yeah, yeah. Okay. That was good
Is it
comments, Frank.
is it possible to share the link to the Ohio State article like in the chat or
But
someplace? I'd love to read that.
yeah,
Yeah, I think
Chris,
grab
yeah,
it.
we'll get it in the email we send out here in a little
Okay.
while. We'll make sure you
Thank
have
you.
that, and because we'll send a link to the recording of this session, but I'll make sure I've got the exact link. Bridget, you can email it to me if you want, or I can figure it out. But we'll make sure everybody has it. And
Okay.
Holly was here Googling around, and I think she found an actual like a little app
Hmm.
that has this rating system embedded in it. So
It was created by the vet that you had mentioned.
Dr. Villalobos.
Yes.
Okay.
And so I saw that, and also it looks like Chris, the Humane Society of San Antonio uses it as well. Uses has an article that they put out about this process.
Okay.
So yeah, I'll include some of those in the when I send out an email with a link to the recording.
That would be
Okay.
great. I think it's
All right.
helpful perspective.
Yeah. Okay. Do we have other comments or questions from anybody? I know this is it's not an easy subject, but it's something we all have in common.
I think Bridget kind of hit on this, but sometimes we're not making this decision alone, and putting some guidelines or
Oh, like within a
family,
Yeah.
it can help. Uh,
Bridget, I think you had mentioned this to me that you and Bernie, I mean, this tool gave you a way to sort of reconcile different perspectives. Is that accurate what I'm saying?
Oh, very accurate because obviously no one comes to this decision exactly the same time. And it really let me see clearly where we were off and we were much closer than I had been thinking in my mind. Again, your emotions are just a mess during this time and then with Arn wasn't sleeping well, so we weren't getting good sleep. It was emotionally just very hard.
Yeah.
It was hard talking to each other about it.
Yeah, I remember those kind of situations because it's almost one person ends up being the bad guy, if you will, and the other person doesn't want to be the bad guy, and that's tension right there. And yeah, it's a very challenging situation. All right. Anybody else have a question or comment they want to share?
First off, say thank you so much for holding a class like this. This is really important information to share and a really important tool to get out to folks. One thing that I've heard said before was when you sign up to get a puppy, you're actually signing yourself up to have one of the hardest and saddest days of your life in the future. So this is a really good tool to provide to giant schnauzer owners and other dog owners as well. So thank you for sharing that, and thank you so much for talking about Arn. Like, I'm sorry, I'm gonna start crying too when I think about my first giant and her passing. Thankfully, she passed away in her sleep suddenly due to complications with histiocytosis and pneumonia. So that came fast. But that too was a really heart-wrenching moment in dog ownership. And now I've got my own Sunny right here. She's comforting me. So I just wanted to thank you so much for sharing your personal story with Arn. And I really appreciate this tool because it is a highly emotional time, and it is very useful to have a tool like that just so that it's objective and it's something that you can use when you're having to make that really hard yet really easy decision.
Yeah.
So thank you so much.
Oh, you're welcome.
Thank you.
Uh,
Thank you, Christine.
I have a question. I know we generally don't allow these presentations to be used outside of GSU, but would the club consider letting members use it with their all breed clubs?
Sure. Yeah, there's no absolute rule that the GSU recordings can't be shared. I mean, historically, we've shared them with everybody in the club and then with everybody that registered for the class. But this one it's very good, but it's also very applicable to really any breed. So yeah, I don't think that's a problem at all. So if once you get the link to the recording of this, if you feel like sharing it with your friends or your kennel club or whoever, please do so. Because again, it's something that every dog owner has to deal with, and it's like Christine said, it's one of the hardest days of your life, and anything that helps doesn't really lessen the pain, but it makes it you're doing the right thing, I guess. You don't maybe have as much guilt or uncertainty. So, all right. Other comments from anybody or questions about anything?
Well, I just want to say I was surprised that, it came out in 2004. Of course, it would take a while to get around, but we're, 20 years later, and I was talking with other people about ARN and that, I came across this tool and I actually shared the actual worksheet with many people because they're like, wow, I could use that. That would be so helpful.
Yeah.
And particularly breeders that, have all these puppy people that, could use some guidance at that time also.
Yeah, absolutely. Okay.
And then
If folk, oh, go
one,
ahead.
the, let's see, Adam, I looked up if it's being taught in veterinarian schools.
Mhm.
And it sounds like it is, but it's not a universal standard. It's usually associated with veterinarian ethics courses, end of life hospice care lectures, and client community training is what it's usually associated with.
Okay, looks like Elizabeth, you have your hand raised. You can just unmute, and if you have a question or comment, just go ahead.
Yes, thank you again so much for sharing all of this information and your story. I was wondering if you could talk to how to have a conversation ahead of time with your vet when so well ahead of time to make sure that they are somebody that could come to your car. I thought that was such a great idea, or come to your house, um, to avoid the situation that you talked about with the one dog. Thank you.
Um, well, that's is it, we all value our vets. We all have our favorite vets, and I think it's really important to have a great relationship with your vet before you even get to this time period. But I think, I even I write notes down. I have notes before I, go to the vet so that I don't lose track of anything, and just be, upfront with them and ask these questions. Though I think, Adam might have some additional to share in that aspect too.
Yeah. Frank, is Adam there with you?
He just stepped off. Let me
Okay.
grab him.
Yeah, but I think, I think you should be able to talk to your vet about almost anything, whether it's a problem of the minute or a problem or a situation you're going to deal with 10 years from now. And I
Definitely.
think if a vet doesn't want to talk about it or refuses, that, that's a flag that maybe that's not the right vet.
But
They're not all of them are going to come to your home. That's some of them. There's some reasons they won't do that, and that may be understandable, but most of the really good ones are going to do everything they can to make it as good of an experience as it could be given the situation. So
I think one thing you just said, Bridget, is really important because for me, I get very emotional when I talk about things like this. And so if I have a list written down, it can help me keep on track for what I need to cover while I'm talking to them about something like this. So
thank you, Elizabeth,
Now
for
this
that question. Yeah, go ahead.
this may be a off the wall question, but what is the difference between palliative and hospice care at the end of life stage?
So palliative care, we're talking about improving their quality of their life. Whereas when the dog gets into the hospice period, we're just looking for support. Um, you're not looking to, like, why, I guess an example, I had a vet that he sold his practice, but he was still there. We had a dog dying of kidney failure, really bad numbers, and the new vet comes in and says, I can put you in a research experiment, and maybe improve the quality of your dog's life. And I'm like, no, no, we're just in hospice care. We're just supporting her right now. Her numbers are terrible. And yeah, so that's the difference.
Okay, thank you.
And I would say
Thank
the
you.
palliative care, sometimes, you think your dog's, or it could be, sometimes you think your dog's doing terrible, and you go to the vet and they're like, oh, we have a solution for that. We can help you out. We can take care of that issue. Um, and that's great if that's the case all the time.
And I know I worked in human medicine for many years. In hospice, it's in humans, it's same with dogs, I would assume. But all life saving measures are pretty much done. You're just making that dog comfortable for the remainder of his time with you.
Okay. Thank you all for those comments. Does anybody else have something they want to talk about? Okay. I guess I got one comment. It's not exactly about making the end of life decision, but it kind of plays into it. And it's something one of our vets told us a long time ago is, be careful about making decisions to prolong the life of the dog when it's not really going to have a good quality of life. So an example might be where one has osteosarcoma, bone cancer, and you're talking about amputating a leg and under the hope that that will eliminate the cancer. But if it's an older dog, it's not going to recover well from that. And maybe the cancer's already spread. So before you make, very difficult decisions on very drastic attempts at saving things, you really need to think about the quality of life the dog's going to have during the maybe short period of time that you're giving it. So sometimes the treatment is the cure is worse than the disease, so to speak. And that's something one of our vets told us a long time ago, is to make the last few months of their life as good as they can be versus trying to buy a little bit of time and then being miserable through all of it. So, all
Hey,
right,
that's the story of my dog.
yeah. All right. Does anybody else have anything? Otherwise, we're going to go ahead and adjourn for this evening. Um, like we usually do, we'll send out an email to everybody that registered and signed up for this, and it'll include a link to the presentation. I'll make sure we include some of these other links, like to the paper that Bridget mentioned. And then there's also a link to a short survey. If you can fill it out, it gives us feedback, not only on the presentation, the content, the topic, that kind of thing, but it helps us shape and improve these things for the future. And like we talked about earlier, this is one where once you have the recording of it, if you want to share it with other folks, certainly feel free to do so. This is such an important topic and one that all dog owners deal with at some point. So there's no reason not to give everybody the help that Bridget found useful in their decision, and I think it's going to be useful for a lot of us. All right, Bridget, anything else before we sign off?
No, that's it. Thank you very much.
Thank you again. We really appreciate it. All right. Well, I hope everybody has a good evening, and be on the lookout for future courses from GSU. They'll be announced on Facebook and in the club newsletter and those kind of places. So thank you again. Have a good evening.
Bye.
Bye-bye.